Welcome to Bad to the Bones podcast. On today's episode, Dr. Mostello joins us to discuss current trends in meniscal tears. Dr. Mostello is an orthopedic surgeon, fellowship trained in arthroscopy and sports medicine. His practice focuses on musculoskeletal conditions affecting the shoulder, elbow, and the knee. Dr. Mostello treats patients across all ages and abilities, from young competitive athletes to weekend warriors and active seniors. Welcome to the show, Dr. Mostello.
Thanks for having me.
We're so happy you're here. So on today's episode, we really want to give our listeners some really good insight into meniscal tears, how the injuries occur, some maybe conditions, preventative treatments. But let's start with what inspired you to specialize in orthopedic surgery and continues to motivate you in this field.
So I think, one of the primary reasons I was drawn to orthopedic surgery is that it requires both a comprehensive understanding of the musculoskeletal system, an extensive medical knowledge, as well as, the component of being able to technically be able to execute the procedures as part of the practice. So when I initially went to medical school, rather than seeking some other advanced degree, such as a PhD, I was drawn to medicine because it allowed me to sort of use my knowledge to directly impact the people that I'm treating.
Yeah.
So through my rotations, orthopedic surgery wound up being the specialty to me that encompassed that vision the best. I think it's very hands-on in all arenas, from the office to the OR, and you really wind up making a difference in people's lives, and you get to see that firsthand. That's part of your experience with your patients. And I think there's a lot of reward in seeing that difference and improvement that you make with people and their lives by restoring their function and returning them to the activities that they love. And a lot of times I feel orthopedic surgery and in general all of medicine, it's not easy in a lot of different ways, and it can be very difficult and test you.
Yeah.
So I think when you get that result and you see that improvement in patients, it's very rewarding. I think that's what keeps a lot of physicians going at this point. It's like the reward from that's like more than anything else,
Yeah.
So I think, whether it's something as far as even decreasing people's pain so they can sleep at night, you'd be surprised how many people mention that and how big of a difference that can make in someone's life.
Oh gosh, yeah.
Even beyond just getting them back to, say, sports, even something small like that you wouldn't necessarily anticipate. People are often very appreciative, and it's huge for them. So
I'm sure it's very rewarding when you see someone come in and they're in pain, or like you said, they're having trouble sleeping, and then you do what you do best, and then you see them come back in, and it's got to be just very rewarding to see someone. Is there a particular experience or a patient story that will really highlight what we're talking about in that area?
Yeah, I think since we're here today to talk about meniscus tears, a recent story I had is I saw a young man in the office who was referred to me who had a meniscus tear that was seen on an MRI, and it was a particular type of tear called the bucket handle meniscus tear, where part of the meniscus gets flipped into the knee joint. And
sounds painful.
It can be for sure. It was limiting his motion, and he was pretty young. So again, we'll get into it more in a little bit. But preserving that meniscus is important. So I recommended a repair, and we performed the repair. And I saw him recently, and now he's about 6 months out from surgery, and he's just doing great. And I give him a lot of credit because there's a lot of rehab that goes in for a repair.
For sure.
But his job is very active. He's, does a lot of manual labor, heavy lifting, climbing, and he's gotten back to doing all of that.
That's fantastic.
Yeah. He's got no real pain, and he's seeing his endurance and conditioning come along.
So the meniscus is is it a complicated structure? Can you describe to our listeners where it's located in the knee so we can get a better understanding of, how our daily movements are affected by that?
Yeah. And, it's in some ways complex. I think we're still developing an understanding of it. The meniscus, and you have two of them in each knee, one on the inside and one on the outside. They are situated between the femur and the tibia, and they're a cartilage-like structure, and their primary function is to decrease the amount of pressure that the articular cartilage sees. So a lot of times surgeons and physicians just reference them as shock absorbers, and that's pretty accurate.
Yeah.
So when you tear the meniscus, that's when more pressure gets exerted on the cartilage. And there's some function that they do to serve as knee stabilizers, but it's sort of a secondary function.
Okay. So is it a muscle or a what is?
It's more cartilage than muscle. It's hard to describe the texture. It's somewhat maybe rubbery even. They wind up being pretty robust, but they're not like hard like bone is.
Yeah. And so when someone comes in with a meniscus tear, what are the different types of treatments and recovery options?
Yeah, so this is where things get, a little complex.
Yeah.
It's not terribly complex, but there's essentially 3 different ways we treat meniscus tears. This is where I'll take a lot of time in the office to talk to people and inform them of, again, what the structure is and why we're doing what we're doing. And I like to classify them into an acute injury and then a degenerative injury, which can be from arthritis, because there's 2 ways you can sustain a tear of the meniscus. And how the tear occurs has a substantial impact on how we like to treat them, because how it occurs influences the chances of it healing or the chances of success of the surgical treatment. And I think one thing to understand is sometimes a degenerative tear can seem like an acute tear if you have a fall, because it starts an inflammatory process that maybe wasn't there. But we do know sometimes meniscus tears can be silent or asymptomatic.
Oh, wow. Okay.
And then going from there, you essentially have 3 paths. One is non-surgical, whether it's physical therapy, injections, modifying your activities, oral anti-inflammatories. And then you kind of bridge into surgical treatment, which is usually more meniscectomy or trimming out of the meniscus or an arthroscopic repair.
So is every meniscal tear repairable or not really?
Not all are repairable,
Okay.
particularly the degenerative type, because if you repair a degenerative meniscus, oftentimes the tissue quality of the meniscus itself is poor, so it's not able to hold the sutures that we put in. Secondarily, with the repair, we're not necessarily addressing the cartilage problem, and if the cartilage being rough is what causes the tear, if you repair it, it's just going to tear again. Other than that, even in acute tears, sometimes we'll consider the location of the tear, where it is in the meniscus, because in order for something to heal, you need blood supply. And the meniscus, because it's cartilage-like, doesn't really have a good blood supply. So we're doing things at the time of surgery to use and sort of manipulate the body's own biology to get it to heal.
Interesting.
And what I like to, this is true in a lot of orthopedics, but I've been using the reference of clamping 2 pieces of wood together and trying to get them to stick.
Yeah.
And I can take a clamp, tighten it, and clamp those pieces of wood, but as soon as I take the clamp off, they're going to fall apart. So unless you have a glue to stick them together, they're not going to hold. So our sutures for a meniscus repair serve as the clamp. The body's blood supply and bringing new cells to that area is the glue. So that's the challenge we have today.
Do you see a difference in the meniscus injuries between male and females?
Typically, I don't really see a bigger difference in the types of meniscus tears. Technically, in some of the publications we have, males have a higher incidence of meniscus tears. I don't necessarily think that is because there is, but there's some influence to reporting and how the data is collected with that. But I see both men and women with meniscus tears, both repairable and irreparable.
I mean, I guess anatomy is anatomy, right?
Yeah.
The anatomy is the same. I didn't know if somehow males heal better or females heal differently.
No, I think it's probably a little bit of nature and nurture, what you're doing, the nature of either your occupation or the activities you participate in. Genetics may play a role, though I don't have anything specific, genetics-wise that might do that.
So I'm sure we have some listeners out there who are parents of young athletes, or maybe they're active adults, weekend warriors, and they're just, they may have experienced an injury with their knee and they just keep going. What would be some common symptoms that we should let our listeners know to look out for?
So pain along the joint line, so where most people can figure out where that is. It's sort of where the tibia and the femur meet. It's around level of the kneecap. On the sides of the knee, more concerning sometimes is swelling that occurs within the knee, people who feel that they have fluid within the knee. Those are not necessarily specific, but they can indicate some sort of issue going on inside the knee, particularly swelling.
Okay. And so if someone does get swelling and they just decide to keep going, and they say like, oh, it's only been a couple of days, I'm going to wait a week or two, what's a good time frame that someone should say like, I really need to get to the doctor for this?
I think giving things a few days is reasonable. Usually people are going to have their own threshold of when they think that they need to seek medical care. So if you have a bad injury, you're probably going to the ER or an emergency room early on. But if it seems relatively minor and it's not bothering you too much, then I think waiting a few days is okay, using some ice, elevation, compression. Inevitably, after a few weeks, if there's still swelling present and you haven't seen anyone, you probably should, just to, even if it's, everything seems okay.
Yeah. Well, and if I come in with those symptoms and you determine it's a meniscus tear, what are the type of diagnostic tests that you utilize to determine it's a meniscus tear?
So we're frequently employing MRI as our diagnostic imaging test of choice, because that will enable us to see the meniscus itself.
Yeah.
In cases where there's some arthritis present, sometimes we presume that there's a meniscus tear, because usually when you start seeing the joint space narrow on an x-ray, a meniscus tear is at times implied.
Okay. And with the innovation and your experience in training, are there any trends that you see for the treatment of meniscal tears that, you've really just have evolved?
Yeah, I think over the last maybe 10 years or so, the pendulum has really swung towards trying to repair the meniscus whenever possible. 20 years ago, perhaps it was not as common, but there's been a lot of evolution in techniques and in general research on the meniscus. And I think back in the early 1900s, they thought it was a useless vestigial remnant of something. And now we realize that it's really crucial in joint preservation.
Yeah.
Tears are a part of aging at the same time,
right.
But our treatment of young patients, and I don't want to put a chronologic age on that, but our treatment and our thought process on meniscus tears themselves is we're seeing the push to try and fix them.
Is there some conditioning or some exercises someone could do to prevent that? If I'm an active athlete, or maybe even just a weekend warrior, is there something I should be doing to prevent that tear?
I think just maintaining strengthening and conditioning of yourself is probably the best preventative measure.
Yeah.
It can lessen symptoms. Again, the knee will see forces multiplied by your body weight. So maintaining a healthy body weight is also important in that respect, because decreased body weight is decreased pressure on the knee, decreased pressure on the cartilage, and decreased pressure on the meniscus. And there may be an injury prevention side of conditioning where you're less likely to have a twisting injury to the knee, if you're well conditioned and strong.
And if someone is not ready for surgery, in other words, you diagnose the meniscus tear and you want to try some non-operative treatments or physical therapy, what would some of those options be?
Again, frequently for degenerative tears or chronic tears, we are employing physical therapy. We're doing often steroid injections, which is an anti-inflammatory, to try and control symptoms.
Yeah. And is that something that someone would have to come back for pretty often in terms of injections, or is it like a one-shot done thing?
It's something we'll consider maybe about every 3 to 4 months in repeating. Though if a patient isn't having symptoms anymore, there's no reason to repeat the injection. So if someone's one and done, that's good. We don't have to do anything else.
And the injection is basically just reducing the inflammation?
Yes.
Okay.
There are other injections out there as well. Some serve as anti-inflammatories. I have a lot of patients who ask about gel injections, which is hyaluronic acid. That aims to mimic the viscosity or the thickness of joint fluid, and it has more of a mechanical mechanism of action than the steroid, which is more metabolic, if you will.
Yeah. And so when those treatments don't work and it's time for surgery, what does surgery look like? How long does that surgery take, and what is estimated recovery time?
Yeah, so on the degenerative tear, the meniscectomy side of things, where we're going in arthroscopically, which is the use of a small camera and instrumentation through small incisions, something like that can take maybe 30 or 45 minutes to trim out the tear. There's not a lot of weight-bearing restrictions after that surgery. Again, sort of reserving that for when non-operative treatment hasn't worked or given long-term relief, as a means to see if we can help people's symptoms. But sometimes with that, again, it can be sort of a bridge, and it may not be a permanent solution.
Yeah.
On the side of meniscus repair, that can take a little longer sometimes, maybe an hour, maybe 90 minutes, depending on the size of the tear and how many sutures you have to put in. And with that comes some restrictions on weight bearing and a longer recovery. But again, in that situation, you're preserving the meniscus, and you keep that shock absorber effect.
And is someone able to get back to regular activities, or is it just, can't get back on the field, but you can walk up and down the stairs?
Eventually, that's the goal, regardless of which procedure we pursue. It's trying to get people back to doing what they like to do. But
that's great. I mean, that's probably the passion of your business, right? Like you started out by saying that, what you do in your practice is enjoying seeing someone come in and they come back feeling better and living an active lifestyle. Well, I think we've provided our listeners with a lot of good understanding about meniscal tears and how the condition starts and some different techniques to treat. So if you or a loved one is having some issues with your knee, some swelling, some pain, it might be a meniscal tear. So you might want to call us today at 856-690-1616. Schedule an appointment with Dr. Mostello. You can also go online to our website at poasnj.com. And we have 12 offices across the southern New Jersey counties. We are in Camden, Gloucester, Cumberland, Salem, and Atlantic counties. So we hope to see you at one of those locations. Until our next episode, stay healthy and have a great day.